Bismillahirrahmanirrahim. Assalamu alaikum. Today I want to talk to friends who are working in outpatient departments and daycare centers. They are dealing with all sorts of patients. Whenever doctors are performing OPD duties, he must know something about everything. You know, you get patients from all the departments, pediatrics, gynecology, orthopedics, and all the departments. Some few of them are suffering from itching. You have to check them properly and screen the patients. At least you have to manage scabies over there. The purpose is scabies elimination drive. It means that you have not to refer scabies patients to the dermatology department. This is for the purpose so as to reduce burden of patients from tertiary care hospitals. For example, for the proper screening of patients, you have to take history of the patients. History is very important. History of contact is important. As far as you take history of contact in tuberculosis patients, you have to take proper history of contact in case of scabies, that how many of the persons living nearby are suffering from itch. For examination, you have to expose the patient. If after taking consent of the patient, you will often in the scabies, faces are spared. You have to examine groin region, axilla, umbilicus, nipples, finger webs, and flexures of wrist properly. Stages of lesions formed are to be noted properly, kindly. First of all, itching starts after 3 to 4 weeks of infestation by Sarcoptes scabiei female organism, which lays eggs in burrows. Then itch starts. Itch After itching starts, then papules are formed. Papules are little uh, in size. Then nodules are formed, and if immunocompromised patients, crusting may occur. These are the different stages present at different sites. So you have to examine the patient very properly and take proper history. If these lesions are present, you have to manage it in the OPD and rather than to refer it. For the sake of proper management, there are different regimes. For a few of the persons treat it, you have to give antihistamine to all of the patients. You can start with cetirizine, levocetirizine, fixofenadine, or whatsoever in the just in the evening hours, and after that you have to prescribe antiscabiatic. Out of antiscabiatic items, you can prescribe permethrin 5% lotion from neck to whole of the body, properly applying at night and for the sake of 10 to 12 hours. Few of the persons prefer crotamidone 10%, precipitated sulfur, benzyl benzoate are also used. But as far as my experience of treating scabies patients and after working in a tertiary care hospital, combined military hospital under supervision of my worthy supervisor and professor, Colonel Farooq Sahab, and after working in Fauji Foundation department, my experience says that ivermectin and permethrin lotion are the safest and most effective treatment. Kindly manage it in the proper primary care centers so as to reduce burden in tertiary care hospitals. Thank you very much for listening.